A person comes to the hospital with a life-threatening brain injury, such as a stroke, lack of oxygen, or encountered an accident. The doctors will work hard to save the patient's life. After a long period of time, the doctor found that the patient experienced irreversible coma and loss of brain function. Doctors will judge whether a patient has a possibility of brain death based on the following 5 points. Brain injury, lack of autonomous breathing ability, reflex nerve loss of response, fall into a non-drug-induced and irreversible coma state, have been treated in the intensive care unit. After the patient is confirmed to meet the above 5 points fully, the doctor will preliminarily determine that the patient is brain dead. There will be 2 doctors who are unrelated to organ donation conducted a series of clinical tests for affairs to confirm that the patient's nerves have lost their response. When the patient's 12 reflex nerves do not react to testing, the doctors will confirm the patient as clinically and legally dead. Moreover, this test will be conducted twice, with an interval of no less than 6 hours between the 2 tests to ensure accuracy. After the doctor conducted rigorous procedures to identify the patient's death, the doctor went to inform the family. At the same time, the hospital will contact the Organ Procurement Organization, OPO, to manage the organ recovery process. The OPO will check the state organ donor registry. If the person is already registered as a donor, there will be a professional coordinator inform the family to provide psychological assistance and persuade them to respect and agree to the deceased's wish to donate organs. If not, the professional coordinator will ask the family to authorize the organ donation. A group of professional doctors will handle the organ transplant surgery. The system will immediately compare to find a suitable match. As long as someone on the national waiting list matches all conditions, the hospital will immediately notify patients waiting for organs to rush to a specific hospital to wait for transplantation surgery. A surgical team will recover the organs. Just prior to being removed from the donor, each organ is flushed free of blood with a specially prepared ice-cold preservation solution that contains electrolytes and nutrients. The organs are then placed in sterile containers, packaged in wet ice, and transported to the recipient's transplant center. The transplant period of the organ being removed from the donor is as follows. Heart, 4 to 6 hours. Lung, 4 to 6 hours. Liver, 8 to 12 hours. Kidney, 24 hours. The recipient and transplant teams are waiting. The doctor will remove the failed organ and then replace the organ. It will take healthy living and medications to keep the organ working well in its new home.